And then coming to next stage of ischemic heart disease is non-ST elevation event. Patient has chest pain, classical chest pain. Patient has cardiac enzymes elevated, Prop.T or whatever elevated, and there is no ST elevation in the ECG. So these patients belong to a special category of N-STEMI, non-ST elevation MI. So these people also have to be equally at risk, and they have to be treated as equal as your STEMI. Okay, that is N-STEMI. And next stage is STEMI. Classical patient coming with chest pain, sweating, and then you have to take an ECG, you have classical ST elevations in the culprit vessel territory. So that is STEMI. Then next is patients can come with heart failure. Patient can come suddenly with heart failure, previously unknown, previously no chest pain, nothing. Or they may begin with chest pain and go into heart failure. So patient can come suddenly for the first time heart failure. Then, as I said, sudden cardiac death is sudden cardiac death. Many people, without they knowing, they die, just die in the sleep. So that is called sudden cardiac death. Or middle of the night, they get chest pain. By the time they prepare to go to hospital, on the way or in the ambulance or just before reaching the hospital, just after reaching hospital, they die. So that is the big spectrum of coronary disease. We should be aware of all these things, and we should never ever take this disease lightly, especially when you are on the night duties. Many times what happens is there are two types of patients. Some people think that in the middle of the night I had some chest burning. Even burning is chest burning is don't think that always it is acidity. So many times what happens in the middle of the night, patient could have some burning sensation in the chest. They think that this is acidity. They blame they will blame it to the spicy food they must have eaten in the dinner. They think that it's acid and they take some tablet or drink some syrup or something, and next morning they are no more. Versus another group of patients who have chest pain, they rush to hospital thinking that many times they rush to hospital. Always it is normal, always it is because of the acidity. So these two things are always, they overlap each other. All abdominal pains, you should think in terms of coronary disease. All chest pains also you should think, keep in the mind of the stomach related, abdomen related issues. They are all, it's not an easy thing always, especially when you are doing a night duties. It's very difficult. Sometimes first ECG may be normal, as I shown you in one of the pictures. First ECG may be normal, you may have to keep the patient under observation. Many times it has so happened, a patient has chest pain, they go to some doctor, some small time hospital, ECG is normal, you don't have anything, which job. Patient is sent home, night he is sleeping, and in the morning he just no more. So these are the possibilities. So first ECG should never be, whenever there is a clinical suspicion, ECG has to be repeated after 4 to 6 hours, at least 2 more ECG. Total minimum 3 ECG you have to take. You have to, of course, confirm by the cardiac biomarkers like troponin T and CPKMB and things like that. So these are the very important things. So coming to ECG, again, as I said, ECG may be purely normal. So and sometimes they may come with chest pain and sweating. Sweating is also very important. And they feel that there is impending doom. They feel that, oh, maybe chest pain I'm sweating. Maybe I'm getting a heart attack. I'm going to die. That's a sensation, a feeling of impending doom is also described in the book. The chest pain, sweating, sensation of weakness and impending doom. And this chest pain can radiate to many sides. Typically to left shoulder, left arm, and atypically right shoulder to right arm, epigastric region, jaw, ear lobules, and interscapular area. We have seen many patients coming with interscapular area pain. ECG shows acute MI. So typically, it's a retrosternal pain, mid chest pain. Typical radiation is towards the left hand, left shoulder. Atypical radiation right shoulder, right hand, and epigastrian, chin, and the ear lobules and the interscapular area. These are the atypical sites. And sweating is the most common accompaniment of this pain. Anybody, elderly man, middle of the night, complaining of pain with sweating, rush them immediately to hospital as early as possible. We have saved many people on phone. They said, I got this. You please rush to hospital. We have saved many patients by just early phone. Many patients. And next morning, they are already in the night. Doctor must have done ECG and then some stenting or something. They must have done patient already. So that is the importance of the coronary artery disease, because life is very important. Here, time is more important. Time is muscle, muscle is life, muscle is your heart muscle. Okay. And what is other test? When somebody has a recurrent chest pains, we don't know whether it is angina or what is the meaning of angina? Exact meaning. Literal meaning of angina. It's a Latin word. Anybody typing?
Steel.
Hmm?
Steel.
Steel. Angina means strangulation. Angina means strangulation. Somebody is squeezing your neck. Angina is the literal meaning of angina. Okay. And TMT is another test. TMT, whenever you have a doubt, somebody has said that I'm getting on and off chest pain. I don't know whether it is cardiac or not. And when they're sitting, they're going, the pain is disappearing on sitting, taking rest. We really don't know. It is not typical of angina. So what we have to do, we do also do a TMT test. When you submit the heart to a little more stress in the form of treadmill, walking in the treadmill, there's a protocol, there's a Bruce protocol. It's called TMT. Also, it has appeared in one of the undergraduate final year examination, one of the short notes. TMT, treadmill test or stress test. So when you give stress to your heart, if it is a silent ischemia, it will be shown. The ECG changes might come after you walk on the treadmill for 9 minutes. Every 3 minutes, we increase the speed. You must have speed and the inclination also we increase. We put more stress on the heart. So at the end of 9 minutes, that's the protocol. If there's no ECG changes, that means your TMT is normal. But again, it has its own limitation, especially in females. Females, the changes are actually ECG changes. There's a gender difference of the ECG. What is abnormal in men may not be really abnormal in women. Women have little normal variations, abnormal variations on ECG. So females, even if they have some changes, they're non-coronary. So certain changes in females, you can take it as a, because of their fatness and the soft tissue around the chest, also can give rise to false positive changes on ECG. So that is one very important thing. And even the TMT interpretation is different from male to female. Very careful. So that is all about your coronary artery disease. So now you do angiogram. You do angiogram. There are two things angiogram. One is emergency angiogram. If the patient comes in first 3 hours, that's the window period. There are two options of treatment. One is you thrombolize with thrombolytic agents like your streptokinase, urokinase. They are all outdated now. We are giving histoplasma and activator in the form of arteplase and place. This is thrombolysis. You lyse the clot, provided the patient comes to within the window period of 3 hours. For stroke, we discussed it is 4.5 hours. For MI, it is 3 hours.